I'm Vickie Hawkins, the Executive Director for Médecins Sans Frontières in the UK. I've just recently returned from a visit to Afghanistan. I went because there's obviously been a transition of power in Afghanistan. The Islamic Emirate of Afghanistan are now the responsible authority. Our teams carried on working throughout that period of very intense fighting. And in the meantime, we've also seen a real deterioration in the humanitarian situation and an increase in our patient numbers. Boost Hospital, it's a Ministry of Public Health hospital in Lashkargah. It's a really big facility, over 300-bed hospital. It covers lots of different wards. There's obviously an emergency room, inpatient facility, inpatient departments, the internal medicine wards, paediatric wards, infectious disease. The hospital is extremely busy. It services around 750 patients a day, which is a very high number for an MSF facility. In the deliveries ward, we're seeing about 60 deliveries a day, and so that's about 2,000 a month. And just to put that into context with my own local hospital, they do about 6,000 deliveries a year, so Boost is doing in 3 months what a large London hospital is doing on an annual basis. In terms of why we're seeing the increased patient numbers that we're seeing at the moment, there's probably a number of different factors that are at work. The first is just that access to the facility has improved, whereas prior to the transition of power, people wouldn't have been able to make the journey to Boost. It would have been dangerous for them to do so. They would have encountered insecurity, potentially landmines, checkpoints, etc. along the way. Now, actually, there's much more security and stability in the rural areas, so people can take a journey that otherwise they might have thought was too dangerous to do so. There was one caretaker that I was talking to whose the account that she gave me has really stayed with me. So she was in with her 11-year-old granddaughter. Her granddaughter had been admitted with TB meningitis, and she was terribly underweight for her age. She'd been an inpatient at Boost Hospital for 2 months, so obviously a really long time. And her family, she came from a family of daily labourers, extremely poor, really scraping together a living. In any other facility, the cost of two months of inpatient care would have just been prohibitively expensive for the family. They wouldn't have been able to afford it at all. But obviously the free service at Boost means that for that family, their granddaughter has a chance. She had been slowly putting on weight, but it was a slow process. And the grandmother showed me a photo of her when before she got sick. She was a beautiful little girl, and she was actually really emotional about what Boost meant for her granddaughter's chances of recovery. Our concern today is that the focus is on how the humanitarian system can substitute, but the humanitarian system isn't designed to substitute for state-provided healthcare. We can't even begin to meet the vast need that exists in Afghanistan today. We can work where some of the need is greatest, but the idea that the humanitarian system can compensate for the absence of a functioning state-provided healthcare system, it's just completely inconceivable. The health needs today are absolutely huge, and your support today is more essential than ever. So thank you.